Thank you, Las Ciancurla. Minister, I accept your bona fides in tackling youth mental health, but reading your speech today, it would be unclear to anybody that we're facing a crisis in mental health. I gave a talk recently at a conference held by the Association for Child and Adolescent Mental Health. And I was talking to youth mental health workers, psychiatrists, beforehand, and one of them told me there's such low morale now in the service that they're finding it impossible to hire people into youth mental health posts. One psychiatrist told me that access to youth mental health services is now so bad that GPs outside of Dublin are writing letters advising that the young person is at serious risk of suicide, advising that person to go to an emergency department in a Dublin hospital in order to skip the queue with that letter to get access to youth mental health services. That's what's going on today in our country. And there is no recognition of how bad the situation is in mental health and youth mental health. Now, A Vision for Change recommended 8.24% of the health budget should go on mental health. We're at 6%, and the UK is at 12%. Now, in the last 7 years, we've lost over 1,000 mental health staff. And that means that our staffing levels are less than 80% of what's recommended in A Vision for Change. But as well as adequate funding, obviously, the system needs to be seriously modernised. The Mental Health Integration Index examines the progress of European countries in helping people manage their mental health to recovery. It looked at areas including providing a stable home and family environment, access to health services, improving work and education opportunities, reducing stigma and increasing awareness. And out of the 30 countries surveyed, Ireland came 14th out of 30, 16th on access and 17th on opportunities for those in need of mental health support. And in youth mental health, Minister, the situation is critical. Young people in Ireland are facing a suicide rate that is in the top 4 in Europe. Over 1/5 of young adults indicated that they've engaged in self-harm. A study of LGBT young people found that 1 in 5 has attempted suicide, 1 in 4 has self-harmed, and 1 in 3 has thought seriously of ending their lives in the past year alone. And Ireland's response? As of December last year, we had just over half the staffing level recommended in youth mental health for A Vision for Change. Minister, there are many solutions. We need to move urgently from a paediatric adult model to a paediatric youth adult model. Young people should not be entering the system. I'll finish on this, Las Ciancurla. Young people should not be entering the system via health centre waiting rooms, but via suitable access that's stigma-free. We have to remove the siloed access that only kicks in at critical stages for young people and move to early detection and a comprehensive suite. And finally, Minister, we've got to move from a paternalistic approach to youth mental health and actively include the youth in designing a system that is appropriate for them. Thank you.